Good afternoon, everyone, and welcome. My name is Kalkidan, and I'm a dentist and a member of Ethiopian Dental Professional Association. And I have a pleasure of moderating today's Pan-African webinar on infant oral mutilation and traditional teeth sharpening practices. And we're very privileged and honored to be joined by Dr. Abdalla, a highly respected dentist, a Dean of Faculty of Dentistry at NGUC, founder of SomDent, and also committed oral health advocate and a lecturer in Somaliland. His leadership and regional experiences will add immense value to our dialogue today. And so this webinar isn't just about information, it's about continental collaboration. These traditional practices are cultured, rooted, and they also raise real health concerns in infants and children. And so our goal today is to basically bridge the traditional and the oral health care through a respective conversation, scientific knowledge, and community engagement. And so I encourage everyone here to be active participants. Please share your perspective, ask questions, and bring in your country's experience so that this collaboration can be a true collaboration of Pan-African webinar conversation. Thank you again for being here. And with that, let's begin. Dr. Abdalla, welcome.
Thank you very much, Dr. Kalkidan. And thank you to the EDBA team for their effort to give a good information and collaboration between the African continent dentists. It's my pleasure to be here today. I would like today to introduce the so-called infant oral mutilation. This practice is very harmful practice that our children is facing. It is something that is very dangerous, and sometimes it may cause a fatal death. That is a malpractice. It is performed for so long time in our African countries. This tradition is removing of the primary canine buds, tooth buds. You know, the stages of tooth, the early stages of tooth formation. In the stage of tooth bud, the mother and the parents bring the children to the traditional healers to see what's happening in their children's mouth, and they are assuming that there is something inside. That's not a normal thing. So they go to that traditional healer, and after that he make this terrible or dangerous traditional malpractice. So we said it is a primary tooth battle. We see it in East African countries, in Central Africa, in West Africa. We see it in East Africa, in Burundi, Ethiopia, Kenya, Rwanda, Somalia, Somaliland, South Sudan, Tanzania, and Uganda. We see these ones. Also, we see in Central Africa, in Democratic Republic of Congo and Chad. In West Africa, we see it in Burkina Faso. Although we can see it in so many other countries in the world, but this area is very common in this tradition. You can see in the map, they are all in nearby and same place. So the people in same place, they share a lot of things. They share the tradition, they share sometimes the cultures. So that's I think the main reason that these people are in same with this tradition. Although they have different names and different languages, but in this, when we come to this tradition, infant oral mutilation, they are in the same, they believe the same thing. We will see it. The reason for removing this teeth or this tooth is the myth surrounding the tribes or the people they are here. You always see their children in situations that they cannot stop of going to the traditional healer. They see their children having a fever, vomiting, loss of appetite, and diarrhea. These signs and symptoms are very normal when the young children is going in the process of teething or when the teeth are coming out. this, they are saying this thing is not normal, but it is the natural development of the immune system of the children. But they say there is something when they say when they see a tooth bud inside, or they say it is a tooth worm within the jaw. So they go to the traditional healer, and they say there is something. The gums are swollen. When we are dentists, we know that when the teeth is erupting, there is a lot of signs and symptoms we see in it. It is swelling of the gums. There is a drooling. Also, the young children may face also difficulty in eating, vomiting, fever, loss of appetite. So it will happen. Will happen in the normal process of immune system and teething process. In this age, around 8 months to 1 year, in this age, it is the most common people that we see this tradition is happening to them. Who do the practice, or who is the here? It is the traditional healer. He doesn't go or he didn't want to any educational process or health educational process. He didn't go to any place. If you can see this picture, I catch it, or I screenshot it from a terrible video that a Somali guy is doing this terrible tradition or practice. You can see he's doing it in the floor, and he is not having any basic instrument that is sterile. He doesn't have any gloves. We will see it later. This video is about how it is happening, how they are doing. This video is I recorded it around it was 2019. Before I came to Addis Ababa for a conference about an infant oral mutilation. So we said we have to, in the conference, we have to present, every country have to present what he have or what cases he have back in his home. So I prepared this video. I went to the market because here in Somaliland, or in general in Somalia, the tradition or the infant oral nutrition is very common. You see it in the streets, even they do it in the streets. So I went to one of the markets, and I went to this guy, and I asked him how he is doing this practice and how much he is taking from the people. And he said to me, we take around $5 per person to perform this dangerous. Also, he said, I was doing it from where I asked him from where you got this knowledge and how long have you been doing this? He said, for the last 10 years, I was doing this, and I am taking it from my parents. My father was doing like this. So it is something that is very, very dangerous. I am asking the doctors if I can share this video with you, or if there is anyone who cannot see this video, I may skip it, or he may wait, because I want to share, because I want everybody to see how it is happening. I recorded it, but I was not, uh, what we say, I was saying to him stop, but he cannot, because he was doing it, and he is doing it a lot of times every day. Even I saw some teeth in the ground. Every day he's doing like this. So I want to ask the doctors if I can share it I want to ask for consent. Okay, I think I can start right now. And I want, while he's doing, to show you a lot of things that you notice from this procedure. Okay, 1 minute. And he is in the market, as you can see at the beginning of the video. This thing is he's boiling the sharpening thing that he want to remove the tooth by it. And then he's making something that's cooling. He's dropping a water from this bottle to this area to coil, and then he bring the child, and this one is her mother. You can see it. He's taking a sharp thing from the ground, and he's calling his friend to catch the child. You can see he's holding the child in his legs. He's putting inside his legs in a position, and then he bring the sharp thing to remove it. Remember, and you can see there is no anesthesia, there is no gloves, there is no sterile thing is here. It is in the market. He is doing it in the ground. You can see it. I'm sorry, I think it's, yes. He's doing like this. Then he make a incision. I zoomed it to see it clearly. As you can see, he took a bicep, something that's very sharp, to remove the tooth, while she is screaming too much. The baby is screaming too much. You can see he's removing a tooth bud. Actually, not just a tooth, it's a tooth bud. He removed the first one, and then without any, he didn't stop the bleeding from the baby. You can see it. And he even used, this one is very clear, I think. He's sharpening the area. The tooth bud is, then he's taking it out. You can see it. He's using force. I remember after that, he said to the mother, take the child and give her a milk, he said. After you finish, give her a milk. You can see how terrible is this procedure, or this harmful tradition. This one is in our country, we do like this in the market. That's the difference between our country here, Somaliland, and I think Ethiopia or any other place. The other places, they said we do it in secretly, but here it is very public. We do it in everywhere in the country. Okay, what is the consequence of this harmful tradition? As you can see in the video, it was a very painful or unbearable pain. Also, there may be a severe blood loss leading to anemia. The unhygienic method can cause blood infections. As you can see, he was not wearing any gloves or protective things. It may cause a hepatitis, tetanus, osteomyelitis, septicemia, HIV/AIDS, and sometimes can lead to the death. You can see he only used the boiling water. He boiled the water. Then after that, he cooled it with the water. Then he took, and he doing in the same same sharp thing, only he has this one, no other one. He is doing it in every patient, everyone he do it. Okay, consequences that was systemically. In dentally, you can see in this area, we saw this two pictures are real patients. We see it in everyday practice. You can see in this side, this is the canine, the normal canine, and this is the lateral. Okay, you can see it. There is a crowding. Also here in this side, you can see it. Here there is a what? He become malformed. In this lower picture, you can see this is the permanent canine. He became like this because of the terrific traditional removal of the canine. Okay, in different countries, we said we are the reasons for removing this infant oral nutrition or the canines is the same in every place in the world, but everyone have his own name. In Uganda, they said it is nylon teeth, Ipinio. Its name is Ipinio. In Tanzania, Lawa Lawa, I said. In Sudan and South Sudan, it's called as Lakbir. In Somalia or Somalia, we said it Il Kadawa or a fox teeth. It is the meaning, same meaning. Killer canines in Sudan, Ethiopia, and Uganda. So we have the same reason is to remove the tooth, but in different languages. Historically, it is very before Isa, but in recent times, infant oral mutilation was first reported in 1905 by Richard Gigi, and also in 1932 we saw it in Sudan, in Tanzania in 1983, in Ethiopia in 1990, in Kenya in 1995. In Sweden, there was an Ethiopian migrant, they went to 99. In UK 2000, a Somali guy went there. USA 2008, an Ethiopian migrant went there and they saw this terrible teeth. New Zealand 2011, in Israel 2018, Ethiopian migrant went to and they saw this teeth. Epidemiologically, they have shown prevalence despite to be high in Uganda and Kenya, having reports of prevalence of 35%. In Tanzania, 5.2 and 13 and 16.9. In Sudan, percent prevalence is 10.8. And we believe 25 million children at any given time are affected by infant oral mutilation. Because our people is not aware of this harmful practice, they do it by their own. They went secretly to the traditional healer to do this practice. They even don't consent any dentist about this practice when they are doing it. And after that, I want to tell, and as I said before, we went in 2019 in Addis Ababa. There was an Addis Ababa declaration in 2019. In 17 to 19 June 2019, chief dental officers from East and Central Africa, they went to Addis Ababa to strategize how to end the barbaric practice of infant oral mutilation within 10 years. And we call to an action to end infant oral mutilation. And we said we have to do a lot of work regarding this harmful practice. We have to establish public health campaign in every country, create school-based programs to advocate good oral hygiene, and to educate children and their caregivers in dangers of infant oral mutilation, call for law enforcement agencies to treat IOM and child abuse, and take action accordingly. Treat the IOM campaign as a part of the country-wide oral health plan and strategy with the need to identify dental literacy within respective countries and to meet every year to end in this terrible action. I remember I met with the president of the EDBA, Dr. Miron there, and also Dr. Nathaniel in that time, and so many Ethiopian doctors in that conference in Addis Ababa in 2019. And after that, I always make an awareness about this important topic because this topic is very important and we want to share our efforts to stop this terrible action. In 2019, as I said, if you can see the picture, you can see Dr. Miran and a lot of Ethiopian doctors and from East African doctors. I would like to thank Professor Raman Bedi from Global Child Dental Fund and also Professor Arthur Kimoli from Kenya because they arranged this important meeting. And without them, none of us will become to that conference. So we came to the end of this topic. Thank you very much. My last message is we want to work on to end this terrible practice. Thank you, EDBA team. Thank you, Dr. Miran. Thank you, Dr. Kalkidan. And thank you to the Ethiopian Dental Professional Association team.
Thank you, Dr. Abdullah, for the insightful seminar. And I'll be continuing with artificial teeth modifications and sharpening. Okay, so on my seminar, we'll be taking a deep dive on artificial teeth modifications, sharpening, and reshapings. And in this seminar, we'll be defining what these procedures or these practices are, their historical background and geographical spread, their symbolism, functions, and also their intercessions with public health. And furthermore, we'll explain why these dental mutilations are harmful. We'll understand, as I've said, the cultural roots. We'll explore the health and ethical risks that come with practicing these traditions, their cultural and respective interventions, and also implications in modern dentistry. So, what is artificial teeth modification? Body sacrification or body modifications has always been a very big and integral part of African, even Native American, Asian cultures. Although it is still part of some cultures in modern dentistry, some of them don't really see them as body sacrification. And these procedures or these traditions serve as an important role in helping identify where a person is actually from, which particular households, sub-ethnicity, ethical group they belong to. And the term body sacrification is basically a Western ideology, or the term is somehow modernized, but it is used to describe an intentional branding of a human. It can be either through burning, etching, scratching, or marking of any symbols or words into the skin, gums, or in this case, reshaping of their teeth. So to the ancient African, it was not known as body sacrification and certainly did not carry any negative connotations. And due to this negative connotations that comes with the term body sacrification, especially when it's discussed in the parameters of Africa, many scholars have actually opted to use a different terming, which we now call it body modification, which actually carries less kind of negative and primitive effects. So when we define what tooth modification and artificial teeth sharpening is. It involves an intentional alteration of the shape of the structure and alignment of the tooth, even to a point where they change the position of the tooth for either cultural, aesthetic, ritual reasons. And so there are three types of artificial teeth modifications. The first, as it's been presented by Dr. Abdalla, is tooth ablation. This is basically removing of a specific teeth as a beauty standard or a rite of passage or a way of preventing diseases. The second one is tooth blackening. As you can see in the picture, a beautiful Akan woman from Myanmar with blackened teeth. This is mostly done in Southeast Asia and some parts of Africa for the sake of beauty or from protection from decay of the teeth. And the third one is tooth etching or inlace. This was mostly seen in present-day Mexico, around Mexico and Southern America, in the ancient civilization of Maya or Aztec. These people used to decorate their teeth with metals, even with rubies, sapphires, and so on. And the last one is tooth sharpening, which we will take a deep dive in. So let's take a look at its historical and geographical spread. So the alteration of natural teeth shape was not only done in Africa, but also practiced in different parts of the world. Example can be present-day Mexico, by the Mayan and Aztec civilization, present-day Denmark, or skeletal remains of Vikings, which show evident filed and edged front teeth, possibly for a status of warrior or to intimidate their enemies. And also around the Middle East, in Asia, mainly in Philippines, Indonesia, and Myanmar. And also global context, which we'll discuss, is the diaspora community. When we come to Africa, one of the most intriguing body modification practices in Africa has always been teeth modification and sharpening, which was really prevalent in the 18th century and still continued to the 19th century and also to the 20th century. Even to this day, we can see this practice still being done in rural areas of Africa. Most commonly is seen in Mozambique and Tanzania, in which they shape the incisors as a beauty and tribal identity markers. It's also seen in Democratic Republic of Congo and Zapozap tribe. They file their teeth to indicate social status, and also on Somaliland, Sudan, Eritrea, and Ethiopia, in which canines are removed, and also incisors are shaped for the sake of beauty and tribal identification. So what are the cultural motivations behind teeth sharpening, or why do people in these tribes actually practice these practices? So I try to divide the cultural motivations behind this practice into two: spiritual and cultural, and the aesthetic and beauty. So when we look at the spiritual and cultural practices, one of the main reasons that this practice is still ongoing is it's considered a sign of masculinity, a symbol of warrior readiness among different tribes in Congo, Central Africa, and also Gabon. This ritual is actually done to initiate young boys and girls who reached puberty into adulthood, because at this stage it is actually considered they would endure much pain. That means they're ready for adulthood. And also the Pear people in Tanzania, men used to file their teeth and sometimes still do file their teeth to resemble animals that look like predators, for example, crocodiles, to symbolize masculinity. And the other is for protection and purification. In some parts of Sudan, it's still practiced that these rituals are done for spiritual protection, especially one who's seeking spiritual strength, or a person that is chosen to be a spiritual leader is mandated to actually get his teeth filed. And the other is for aesthetic and beauty reasons. So modification of teeth is considered as a beauty and also as a kind of identification for a social status, especially when these people use gems, gold, sapphires, rubies to decorate the teeth. And one of the most renowned and still currently considered sign of beauty in Africa and also some parts of the Middle East is diastema. So diastema is sometimes considered as associated with fertility, wealth, good fortune, and it is actually got really popularized by celebrities and models in the Western countries that have different African backgrounds. So who does these procedures? The sharpening was done by chosen men or women who are believed to be born with skilled gifts. These gifts are said to be given them by the gods. And these people were either shamans or traditional healers. And they used the methods of either filing or grinding or chipping or notching of the teeth. And they often use rudimentary and very sharp instruments that increase the risk for complications. These tools were not only sharp, but they were not clean. And so they use instruments like chisel and hammers. Mind you, they don't use any painkillers or anesthetics. They just make them chew on a wood, and they use herbal ointments to reduce their pain after the procedures. And why should we care? Why should we as dentists care about this topic? I believe it's not just a dental problem, it's a public health issue, cultural and also human rights concerns. And without any safety alterations and community educations, our generation will continue to suffer this preventable harm. So furthermore, we'll be discussing the intersection between public health and traditional teeth reshaping, and we'll also take a look at the impact of this practice and its challenges to eradicate it. So the realm of ancient dental modifications, while they're really rich in culture, it brings a very different, very big potential risk for health and different health consequences. They also present medical legal concerns for dentists, especially when performed under unsafe conditions. And the immediate risk for this practice is one of the main risks is the exposure of dentin and pulp, which can cause pulpitis, loss of tooth vitality, often requiring root canal treatment or extractions later on. Mind you, both procedures are not accessible in rural areas. Other than these immediate risks, other immediate risks are excessive bleeding, infection due to sharp and unsterilized tools, which can introduce bacteria to the gum, causing gum infection, abscess formation, osteomyelitis to the jaw, and potential life-threatening conditions like meningitis and sepsis. This practice also carries the risks for transmission of bloodborne diseases like hepatitis B, C, tetanus, HIV, and so on. And let's not forget that these procedures are also done without numbing agents, and so they create a very excruciating discomfort, triggering intense stress syndromes and responses, like our patients might actually go to shock. And also painful and forceful procedures, especially without anesthesia, can cause long-lasting dental anxiety and phobia, leading for these people to avoid dental care in adulthood. Moreover, the psychological impacts on these individuals, particularly immigrants who have gone these procedures, can never be underlooked. The embarrassment or discomfort associated with their dental status can significantly limit their ability or their want to smile, speak, engage in any sort of social interactions. And so not only does it has a dental impact, it also has a psychological impact. It can affect their body image and their cultural pressure, social stigma are also things that we should not forget. The other long-term occlusal and speech problem is that change of tooth shape can disrupt the way the upper and the lower teeth feet. And also it can cause TMJ disorders. The teeth that are chipped can have accelerated wear, and these patients might have articulation issues. They might not have a good speech, or they might experience lisp and also adaptation change. So this practice has been really hard to eradicate because of its ethical, clinical, and also cultural complexity. One of the most challenging issues is the idea of human rights versus cultural relativism. So where do we actually, as professionals, our dentists, where do we actually draw the line? Where between like respecting a tradition or protecting a child? And so we should recognize the need to balance cultural preservation and also harm prevention. The other thing is informed consent. So infants and children cannot consent. So is this actually considered child abuse or not? Should be our question. And in the eyes of the human right lens, procedures performed without informed consent, especially in children, violates their right to health, bodily autonomy, and safety. And so our role as a dentist and health workers is to intervene without alienating our community, to do community engagements, to do successful interventions with elders, cultural leaders to adapt and replace these harmful practices with safe symbolic rituals, and also address the diaspora dilemma, which is how we should handle cases like these in immigrant communities in Europe and Northern America. So what are our roles as dentists? Our roles as dentists are there. We have basically four main roles: to heal, to prevent, to advocate, and to respect. And one of out of the different roles that we have, the main one is clinical responsibilities. I would say the main one, but others would say we have a lot of many main roles. But I think as clinicians, clinical responsibility is the main one. So we should diagnose and treat, do early interventions, rehabilitations, and so on. And the second one is to prevent and educate. So our role is preventive and educational role. We should educate our patients, do community outreach, use visual aids, use either before and after pictures to show the communities the damage that these practices are doing. The third is cultural sensitivity and trust building. So we should have a non-judgmental approach. We should be actively listening. We should come up with collaborative solutions in which we should work with cultural leaders to create more of a safe symbolic substitutes, such as decorative jewels, temporary coloring for these practices. And the fourth one is basically advocating for health, for public health. So we should work with policy input, we should work and collaborate with NGOs, we should also report and collect data regarding these practices. Other ethical obligations that we have is informed consent. So we should always ensure procedures, especially in minors, are explained and consented to, and these practices should not harm the child. So we should protect the child, and we should balance the respect, safety, and cultural heritage of these people. So as dentists, our interventions mainly depend on building trust. So by building trust, our community will approach us with their problems, seeking for solutions. And then we can introduce safe symbolic alternative, as I've suggested before, like using removable decorative caps made out of these golden colored resins that people can use to mark their right for passage in certain parts of the community, so that they won't be alienated from not practicing the culture. And the second is, as I've said, introducing safe symbolic alternatives. And the third is community campaigns and partnerships. And so in some cultures, traditional dental modification practices continue to this day, preserving rich heritage and identity. These practices, while perhaps are not widespread, they remain a significant part of the culture and traditions, and they basically link us, the current generation, to our ancestors. And modern dentistry, I believe, has developed a more holistic approach, recognizing the importance of preserving cultural practices while ensuring the patient's safety. So treatments now emphasize minimal invasive techniques, rigorous sterilization processes, and also informed concepts and bridging the gap between traditional practices and contemporary health standards. So today, procedures such as veneers, orthodontic treatments, and whitening reflect an ongoing human desire to modify our dental appearance for the sake of being accepted by our society. So for the sake of either beauty or being accepted to be a part of one society. So we can say that this practice not only has cultural influence, but also influences the current modern, especially modern cosmetic dentistry. So while technology advances and echoes the motivation behind ancient dental modifications, the desire to be attractive, the desire to be beautiful, the desire to be to have a beautiful smile aligns with the societal standards of beauty. And so this includes the global trend towards a white teeth, towards a straightened teeth, which has become common aesthetic goal in many societies. So while ancient dental modification practices might seem distant and disconnected from our today's world, I believe the influence still persists in various forms and adaptations of modern dentistry. And I would say it's a legacy. So I hope this seminar was insightful, and I would like to thank everyone for attending,